glad you can join us from Croy.
Pleasure. Greetings from Seattle.
So the news about the London patient is all over the media. And of course, what I'm concerned about is making sure that people living with HIV understand what we're hearing and what we're reading about.
Yeah, sure.
So the first question I have is, they say it's a proof of concept. Can you describe what that means?
What the London patient report is not a cure for HIV. It's a description of what happened to a man who had to have a transplant for the treatment of his blood cancer. He had Hodgkin's disease, and he received a transplant from someone that was naturally resistant to HIV or CCR5 negative, because they don't have the receptor that HIV needs to enter a cell. Very similar to what happened with the Berlin patient or Timothy Brown. And so the London patient received a transplant. 16 months after receiving the transplant, he stopped antiviral therapy, and there has been no viral rebound or no virus, at least detected in blood, for 19 months now. So that's a very long time for the virus not to rebound. There's a bit of debate at the moment. Do we say he's cured? Do we say he's in remission? Probably remission's a better word, because it's possible the virus could suddenly come back at some time, and we just haven't had enough experience with people who can control their virus for such a long time to know if it will pop up within the next few months. I'd say if he stayed with an undetectable viral load for 2 or 3 years, we would have greater confidence in calling him truly cured, as we do for Timothy Brown or the Berlin patient.
So what's interesting about this, obviously, is that these people have lymphoma. And of course, I'm not prepared to get lymphoma just to be cured of HIV. But what significance does this have in terms of our understanding about the potential for a cure?
Well, there was a huge amount of excitement after Timothy Brown's case was reported back in 2009. And a whole lot of things were done to Timothy Brown. He had bone marrow, he had radiation therapy, he had 2 transplants, he had leukemia, had a whole lot of different drugs preparing him for the transplant. And no similar case has been reported in the subsequent 10 years. So although there was excitement about Timothy Brown as proof of principle that HIV could be cured, we never really understood which part of whatever, all that was done to him led to the virus not coming back. So now we've got this second patient where we know the same things happen. So that tells us that Timothy Brown is not a one-off, but that this is potentially feasible. Now, doing a transplant for people living with HIV, absolutely not an option. But there are 2 things I think that are important that come from these cases. The first is that if you could somehow engineer the body to no longer express CCR5, so that is your dog getting upset there?
Yeah. You keep talking. You keep. Let in.
And if we can engineer someone's white cells to no longer express CCR5, that would be an alternative to bone marrow transplant. I know that sounds very space age, but we actually do have the tools possible to do that. These tools we call gene scissors. So the scissors can literally remove that piece of CCR, that protein or CCR5. Some of your listeners, some people may have heard of CRISPR-Cas9 or gene therapy. So CCR5 gene therapy is happening now in clinical trials, predominantly in the US. And so gene therapy may be one way forward. But the other way forward, I think, is still in understanding how the immune system can recognize and get rid of the reservoir. And I think that was also part of the story here for Timothy Brown and the London patient. They both had something called graft versus host disease, which happens when you mix 2 immune systems together, the immune system of the donor and the immune system of the recipient. they sort of have a battle, and usually the donor immune system starts to attack the recipient's immune system, and that leads to what we call graft versus host disease, which is actually a bit of a headache for people after transplantation, because it can make you quite sick with a skin rash or diarrhea or fever. And in all of the transplant cases that have been reported, in addition to Timothy Brown and the London patient, graft versus host disease seems to be linked to reducing the reservoir. And that tells us that the immune system, again, potentially could be engineered without going through a whole transplant to recognize the reservoir. That's a big leap, but I think that's where the research is going.
So one of the things we've heard about is the CRISPR babies, and this is about gene manipulation early on in babies. Do you think that are you saying that there's a possibility that we could be using gene editing technology on adults?
That's right. Yeah, the CRISPR babies, or the babies that were born in China who had their genes manipulated or edited while in utero, is the same principle, but this is very different. If you edit genes in an adult and you edit genes in someone's T cells, they're going to have no effect on the next generation. And this is done in someone already infected with HIV to give them a new immune system that can't be infected by HIV. The CRISPR babies are a very different story, very dangerous territory to be editing genes that we could pass on to the next generation. That was very controversial. Editing genes in a baby who obviously can't consent, and editing genes in a situation where there's no real medical reason to do it. You and I know there's loads of ways we can protect ourselves from getting HIV that are highly effective, that don't need gene editing. Gene editing for HIV, for people living with HIV, currently means a person living with HIV who's on treatment goes into the hospital, has a whole lot of blood taken. In the laboratory, the blood undergoes gene editing, and then those gene edited or CCR5 negative cells are put back in the individual, and hopefully they survive. And that work actually has been going on for a very long time. The first paper published way back, almost 10 years ago, actually, and starting, and it's still, those clinical trials are still happening now.
Fantastic. What do you think significance does this have for people living in Australia? Do you think that this is something like, so for example, if you're an HIV positive individual and you get diagnosed with cancer and you're scheduled for a bone marrow transplant, is that something that we should be bringing to the attention of people like yourself so that we could look at further proof of concept analysis?
Yeah, I mean, I'm at the epicenter and hear about this stuff, but certainly I hope all the hematologists and cancer specialists are well aware of this too, because we rely on them thinking about this. I should add, this is not an easy thing to do when you have to have a transplant for a cancer. Usually there's a bit of time pressure there because you're very sick from the cancer. You also have to have an immune match. So that's the most important thing. Your immune system has to match that of the donors, and that's a rare match. And then on top of it, the hematologist may need, if he or she wants to find a CCR5 negative donor. Well, only 1% of Caucasians are CCR5 negative. So usually the urgency of transplant and the immune match wins out over the CCR, whether the donor is CCR5 positive or negative. But if you could do both, as was done for the London patient, for the Berlin patient, and for actually there are other patients that have undergone this procedure, that would be great. So it's really the awareness of yes, people living with HIV should know this is a possibility. They should also know that this is a very serious procedure with high risk, but only undertaken because of the need to treat the underlying cancer.
Well, this is fantastic news. Thanks so much for taking time out of your busy schedule to talk to us. If there's other interesting news, please give us a shout. I'd love to do another quick interview from Croy if you hear something and you think, yes, people need to hear about that.
Okay, will do. Thanks a lot, Brent.
Have fun in
See you
Seattle.
later.
Bye.
Okay.